Now we want to get the latest updates from the head of the St. Louis Metropolitan Pandemic Task Force, Dr. Alex Garza, also the Chief Medical Officer for SSM Health, joining us live this afternoon. And Dr. Garza, in just the last half hour, your task force reported 469 confirmed and suspected COVID-19 hospitalizations in our area. That's the highest since the middle of May. How concerned are you right now about these numbers, about this surge?
Well, we're still concerned about the high number of cases that we have in our hospitals. You know, the silver lining is not many or not as high of a percentage of them are requiring intensive care units, so that's always a good thing. But, you know, we're continuing to see those high numbers of admissions, although for the last couple of days they've trended down, so that's a good thing as well. But we want to see that maintain around a 10% capacity for our ICUs and our hospitalizations. So if we can keep it down below there, you know, we'll be happy.
Are we able to do that? Let's rewind the clocks back to about April when we had close to 800 hospitalizations. Are you worried that we soon could be approaching that number again?
Well, we're hopeful with the measures that have been put in place, whether it's the masking or the decreasing the hours in the bars and things like that, that we can start to interrupt transmission in the community. And if we can do that, then we can start seeing that decrease in the number of cases. Now, it's still, we're seeing some glimmers of hope with that decrease in admissions, but it really takes a consistent effort by the entire community in order to get those cases to come down. And so hopefully we can start seeing either a plateauing or even a coming down.
The month of July, a really big month, most increases in cases in the metro area, but while the cases have gone up dramatically, you'll also note the number of actual deaths each month keeps declining. Can you explain why this is happening?
Yeah, so a little bit of it. So one, mortality or deaths is always a lagging indicator. So it always comes on after you see that spike in cases and hospital admissions. So that's one thing. But the other thing is it's a different patient population than what we saw in the spring. So it's typically a younger population of patients. They typically don't have as many you know, chronic conditions. They're not as high risk for being in the intensive care units. And then the other piece is we've gotten better at treating patients as well, and so we've done better at keeping out of the intensive care units and off the ventilators. So you add all that up, and I think that's a pretty good explanation for why we're not seeing the number of deaths that we saw before.
Well, with the death rate declining, better treatment options out there, a number of things, many people feeling right now we should be doing more to get the economy moving, get youth back in sports, in-person teaching at schools. As the medical expert, obviously, on this, why not do all of that if fewer people are getting very sick and fewer people are dying?
Yeah, and so the way to do that is by keeping transmission low. So we know that with a high number or a high amount of virus circulating in the community, you will see people coming into the hospital, you will see people ending up in the intensive care unit, and you will see more people dying. And so really the key is to keep transmission low. And the way that you do that is by face masking and social distancing and not gathering in large crowds. So if we can get transmission down, then we can do those things like youth sports, and we can do things like going back to school. But we've got to get that amount of virus in the community knocked down. And the way to do that is masking, social distancing, and washing your hands and not being in large crowds.
Yeah, can't say that enough. Dr. Garza, thank you again for your time this afternoon. We appreciate it.
Sure, anytime.